Hello all, welcome to Universal Group of Institutions, Bengaluru. Welcome to our very special series on NCERT Economics, where we have been reinterpreting these NCERTs in a manner that is useful for our civil service preparation. In our previous video session, where we have reinterpreted the education as a theme, okay, where we even analyzed the budget of 2025-26 towards the Ministry of Education, and how the Department of Higher Education has got the lesser money in comparison with the Department of the school education or the elementary education. And we also looked at the gross enrollment ratios at the various levels, and as from the primary to the higher education, the gross enrollment ratio has been declining. That is one of the cause of concern. Plus, another grave cause of concern was the funding that we also have seen. Now, moving to the next theme that is being discussed in this particular chapter, that is the people as a resource. Here, the theme that is discussed is being the health through the story of the Sakal and the villas, where we have clearly understood. I mean, the one reason why Sakal was able to outperform, or Sakal was able to contribute more apart from the education, was the health. Vilas, on the other hand, was suffering from the arthritis, where his mother was not in a position to take him to the doctor, as the family was a poor. So, which ultimately impacted his ability to learn as well. So, just moving further ahead in this particular chapter, what is being discussed is the how the better health infrastructure is going to have a positive impact on the nation's economic growth. Again, same, if you look at the historical data, when British left India, the average the life expectancy that was existing around the 32 to 34. But with the sustained investments with regard to the creation of the health infrastructure, be it the primary healthcare, be it the community healthcare, be it the medical institutions that were established towards the the creating more and more number of doctors, India has done well. India has done quite well. Okay, can you see here? I mean, the simple one, the health infrastructure over the years, that is the sub center, primary healthcare, community healthcare center, how that has increased over a period of a time, and how even the dispensaries and the hospitals have also increased over a period of a time, and how the auxiliary nurse midwives and the the asha workers, that is accredited social health activists, how their number has also increased, and moreover the lady health visitors, plus the registered nurse midwives and the even the registered nurses, how their number has also increased. I mean, this clearly demonstrates that the successive government has made the credible investments with regard to the health infrastructure. As a result of this, the life expectancy has been increasing, the infant mortality rate, maternal mortality rate, neonatal mortality rates have been falling, and the life expectancy has been increasing. So what are we need to know? First thing about these definitions, that is the first definitions of this discussion, that happens to be the infant mortality rate. What is the infant mortality rate? Look at number of deaths of infants under 1 year of age. What is the time criteria? That is 1 year of age per thousand live births in a given year is the infant mortality rate. Look at the maternal mortality ratio, that is the number of maternal deaths during the pregnancy, childbirth, or within 42 days of the termination of pregnancy per 1 lakh live births, per 1 lakh live births is the maternal mortality ratio. Remember, that is number of maternal deaths during pregnancy, during childbirth, or within the 42 days of the termination, that you need to remember. Look at the next one, something called as the neonatal mortality rate. That is the number of deaths of the newborns within the first 28 days of life per 1000 live births in a given year. For infant mortality, that is 1. Neonatal, it is the 28 days. Similarly, there is a child mortality rate as well. That is the number of deaths of children under the age of 5 years. Okay, for children mortality rate, it is 5 years. For infant mortality rate, it is 1 year. Whereas for the neonatal, it is 28 days. Whereas the maternal mortality ratio, that is per 1 lakh live births, whether be it the deaths of the mother, that is happening either during the times of the pregnancy, childbirth, or the 42 days, that you need to remember. Look at the life expectancy, the average number of years a person is expected to live based on the current mortality patterns of a given population. And we know these mortality patterns will depend upon the health infrastructure. If we have a better health infrastructure, the life, the deaths are going to decline, so life expectancy is going to increase. Look at the next two, very important one, that is the birth rate and the crude birth rate. Can you see what is a birth rate? The number of live births per 1000 people in a population in a given year, whereas the crude birth rate is same as birth rate, no doubt, total live births per 1000 population in a year, without adjusting for a age or a sex distribution of the population. That means the birth rate will be of a specific. Look at here now, crude birth rate, I've just explained using a simple one formula. What is a crude birth? The number of live births in a year is in the numerator, mid year total population into 1000. Let's take a simple example. If the population is 1 lakh, live births that are happening is 2500, the crude birth rate will be 25. This means that the 25 births per 1000 people per year. It does not care about how many women are of a childbearing age, or the sex or the age structure of the population. Whereas the birth rate is the general concept. Look at, or can be refined one as well. Now look at, for a general fertility rate, we know what is the general fertility rate age, that happens to be the 15 to 49. So general fertility rate, birth rate will be the number of live births in a year divided by the women aged in the 15 to 49 into 1000. So this particular, that is be it the general fertility rate or be it the age specific birth rate, that can be such kind of a fine tuned definitions can be given of the birth rate. This is again very important from the examinations perspective. So never ever get confused between the birth rate and the crude birth rate. Crude birth rate, it's a general concept and can be refined as well. That is whether it is, be it with regard to the general fertility rate or be it with regard to the age specific birth rate as well. Now I have a question for you. You just need to comment in the comment section. You tell me the difference between the death rate and the crude death rate in the comment section. Okay, now moving further, that is what is being discussed here. These, as I said very clearly, the birth rate, the IMR, MMR have been falling down. Okay, even TFR, that is 2.1, that is also total fertility replacement level, that is also gradually declining. That means the women are having less and less number of children. Moving, the important aspect that I wanted to discuss here is about the budget. The way I have done, the way we have discussed about the Ministry of Education budget. Look at here, just few tables here. The expenditure of the Ministry of Health and Family Welfare, that is a table as you can see here very clearly. The budget that has been allotted for the towards the Ministry of Health and Family Welfare, that happens to be the 99,859 crore. If you're not able to remember 859, that's okay, but remember that the Ministry of Health and Family Welfare gets less budget than the Ministry of Education. Ministry of Education has got 1.28 lakh crore, whereas the Ministry of Health has and Family Welfare has got the 99,000 crore in the budget 2025-26. If you look at the bulk, the where which one they got the majority of the fund, that happens to be the National Health Mission. The National Health Mission has a two sub missions. There is the National Rural Health Mission and the National Urban Health Mission. The NHM has a very simple objective. It wants to, at a universal scale, it wants to give a quality healthcare at the affordable rate with the equitable access with regard to those health services. Okay, so it's all about, regardless of the, income should not be the barrier to access the quality health services. That is all about the National Health Mission. First we came up with something called as the National Rural Health Mission in the year 2005, then the National Urban Health Mission in the year 2013. Then, to oversee the implementation of both, we had an umbrella scheme called as the National Health Mission. Now in the same, the phase, I mean, to further in fine tune with the National Health Mission, the government also has come up with the National Health Policy of the 2017. If you look at the National Health Policy 2017 target, which clearly says that the combined, remember, the combined public health care expenditure must be 2.5% of the GDP. Plus, the state government must allot the 8% of their the budget towards the health as well. But I mean, again, if you look at the average state health budget, that happens to be the six. There are states, the prosperous state like the southern state like Karnataka, which has not allotted, not even a 6% of its total budget towards the health. Now just a few more tables that I have for you for the discussion. Can you see one more trend, that is a declining share of spending on the Ministry of Health and Family Welfare in the union budget? That means, as a percentage, if you look at the this year's budget itself, of the total budget, the health has got less than 2% of the budget. That is alarming again. Now that has, come down by the less than, again, from the UPSC's perspective. If you look at the last decade, because these kind of statements are being seen in the examination, the Ministry of Health and Family Welfare's budget as a percentage of the total budget has been constantly declining, not constantly declining. Okay, we see, a increase decrease, so not exactly declining or not exactly the increasing. That you need to remember. The last table that I have for the today, that is the public health spending as a share of GDP is higher in several. Look at India. India is spending just 1.4. Look at our competitors, China. China is spending 2.9% of its GDP. Look at its size of the GDP. Its size of the GDP is a 19 trillion. We are spending 1.4 of the 4 trillion. I mean, even though this happens to be the older one, 2021, where our GDP was somewhere around $3.6 trillion. So look at that. Considering the size of the GDP, we're still spending less. We're spending less, 1.4% of our GDP. Whereas China, which has, almost, whose GDP is more than India, is already spending more. That is 2.9% of its GDP. And prosperous countries like US, that is spending 9.7% of its GDP towards the health. So these are some of the important things that are associated with the health. And the last one about the health that you need to remember is, health happens to be the state subject. So quickly, the summing up in this particular part, what have we discussed? We have mainly looked at the health. That is, we have mainly analyzed the budget of 2025-26 of the Ministry of Health, because this is what I call it as the reinterpretation, because these NCRTs have been designed for the ninth standard students. So how can we make these NCRTs as a useful for our preparation? This is the only way that we can make, reinterpretation that will be useful for our preparation when we, study more and more advanced topics. So that's it in this particular video session. In our next session, I'm going to discuss the next theme called as the unemployment, and which also happens to be the last theme of the particular chapter as well. Do like, do share. I mean, if you have any concerns, comment in the comment section, and do spread this, wonderful message among your friends. Thank you.